The Georgel Cancer Foundation has continued its advocacy visit, this time to the office of the Nigerian Medical Association Plateau State Chapter. Chairperson of the foundation, Mrs. Retsum George, reaffirmed the founder's commitment to unveiling a robust cancer awareness program while seeking collaboration with the association.
Actually, Georgel Cancer Foundation is a new foundation that was birthed out of compassion for those battling cancer. No, it's coming from a personal experience. Yes, we lost our brother last year to cancer. Yes, after battling for about 4 years. So it's not a very funny journey. And during that period, we had a lot of our ups and downs. We didn't know where to go to hold our hands, anybody to hold our hands to like walk through the journey. So it was really a very terrible experience. And after his demise came the depression, the anger, the grief. We didn't even know how to grieve properly. Not until somebody said, oh, there's a trauma healing institute, go there. They had to teach us how to grieve properly. So then I now started imagining those who don't have that opportunity or privilege to meet people like that. So, and I believe in Georgia Cancer Foundation, we believe that nobody should walk through that journey alone. Yes, we want to be like a hand to hold for anybody that finds himself on that journey. And with the recent cases of cancer, the cancer has become like a pandemic, ravaging through families. Not even it's not even concerned whether you are an adult, a child, nothing. The cancer does not even look at that. So we are here to be a hand to hold for anybody that is going through that journey. And with the little we know and the little we have, we want to like partner, collaborate with medical bodies like yours to guide us on really what to do. I know that it entails outreaches to the unreached and all. It will be good that professionals are amongst us who are willing to work with us, like our resource persons that will give us the technical advice, because I know people will trust us more if we have people like you working with us, that kind of partnership and collaboration. So that's why we're here today, to explore means by which we could collaborate, partner, so that we can touch every life that comes our way, take the message out there. A lot of people are afraid to go to the hospital nowadays because they are afraid. Let them not go and say it's cancer. You see somebody with a wound, go to the hospital, say no, I'm afraid. Let them not go and say it's cancer. But I want to believe with early detection, with proper awareness and early detection treatment, people should be able to survive this. It's always a difficult thing here because people always let it be at the tail end, like it's in the end stage before they get diagnosed. So, but with proper awareness campaigns and outreaches out there, people should be able to go for, allow themselves, subject themselves to early screening and all. So that's why we're here today, to partner with all of you, to explore means by which that can be done. Yes, sir.
In his response, the NMA chairman, Dr. Yilji Kuntab, welcomed the initiative and pledged the association readiness to partner with the foundation in achieving its aims and objectives.
Hereditary genetic composition. So I commend your initiative and the objectives of Georgel Cancer Foundation. The fight against cancer, it's not, it's a collective responsibility that everybody has a role to play, and NMA supports any organization. We're ready to collaborate with any organization that would ensure that the health of the citizens of Nigeria, for us who are domesticating it just to Plateau State, is taken care of. So we have lots of areas that we can collaborate. Yes, like you said in your letter, October is more of, I think, October more of a cancer month, so creates awareness for cancer. We can. There are several activities. Whatever program you have, we will support, either like you rightly said, in terms of the human resource. We have enemies endowed with human resources, so We have cancer specialists, both adult and child, like the person I was telling you about is a pediatric oncologist, that is a specialist in cancer. When you have interactions with people, whether community-based or media, we can send some of our members to do that. And then, of course, most programs are cost intensive. So if your budget is manageable, we would be able to support in one way or the other. So you're welcome. Our doors are open anytime, any day. You can always please call on our attention, and whatever programs you have for the month. Let us have a look at it so that we can also help in partnering with you.
It was rounding off with the formal presentation of Georgel Cancer Foundation resource materials and souvenirs to the NMA chairman.